what is the role of genetic and biomarker testing as screening tools?
So genetic testing is very important. So when we get, for example, and I'll kind of back up a little bit to say, if somebody gets diagnosed with ovarian cancer, that is actually everyone who has a diagnosis of ovarian, fallopian tube, or peritoneal, because those are all sort of the same cancer, should get genetic testing to see if there's a hereditary predisposition in their genetics that are passed on. That's called germline testing. And those patients, about 20% of them may actually have a hereditary condition that could be passed on. And then that's where you can see how important it is, so that if I have somebody and her children now know that the person has BRCA gene, for example, then it's really important for her children, men and women, to get screened, because then they may be able to do preventive measures such as preventive surgery, preventive medications, or more frequent screening to be able to prevent cancer from happening.
What genetic mutations are associated with ovarian cancer?
So the ones that are most common that you hear about are something called BRCA or BRCA1 and 2. Those make up the majority of those mutations. There are some other less common ones, such as Lynch syndrome, which is more associated with colon and endometrial cancer, but can have about 10 to 12% of patients related to ovarian cancer as well. So those are nowadays when we do genetic testing, we do a panel. So there's like 35 genes that are tested, that there's a whole lot of different genes that can have an association with ovarian cancer, but the BRCA genes are the ones that most people hear about.
Should women with a family history of ovarian cancer take extra precautions?
It's a very good question. So if you have a family history, it's probably important to kind of talk to your doctor and to maybe even see somebody in cancer genetics who can draw out a family tree for you to see like how high is this risk, right? So if people have an ovarian cancer patient, one, or a breast cancer patient, some of it also matters, like what was the age that that patient got diagnosed. Some genetic mutation syndromes, actually the patient gets diagnosed much younger than average, and the average age for ovarian cancer is about 60. In your 60s, but some patients will get it. Some genetic mutations, it's still about that range. So I think it's important because even if you don't have a genetic mutation, having a family member with ovarian cancer slightly increases your risk, right? So knowing those symptoms, knowing that your history will help your doctor dictate like how quickly are they thinking about something else is really important.